Okay, we're going to talk about planes of motion, joint motions, and reference terms. The first one we're going to work on is dorsiflexion at the ankle. So dorsiflexion, going dorsiflex, and then plantar flex. Dorsiflexion and then plantar flexion occur within the sagittal plane. And now I go ahead and do inversion and eversion. Okay, there's eversion, eversion, and then inversion and inversion. Inversion occurs in the frontal plane. And now go ahead and do knee flexion and knee extension, knee flexion, and knee extension. Both occur in the sagittal plane. Go ahead and do hip flexion and hip flexion. And then the return of hip flexion is hip extension. That's hyperextension. Hip flexion, extension, hip flexion, extension, and then hyperextension. Good. Those all occur in the sagittal plane. And then internal rotation at the hip. And then external rotation at the hip. External rotation, internal rotation, and then now you also have abduction of the hip. And then adduction is returning and going across. So abduction again is going out. Adduction is returning and then going across. And those all occur in the frontal plane. Lateral flexion and lateral flexion the other direction. That's left lateral flexion. The first one is right lateral flexion. Are all occurring in that frontal plane. Forward flexion of the trunk. And then return of flexion is extension. And then you got hyperextension. All of those, again, are in the sagittal plane. And then you got rotation and rotation, all in the horizontal plane. Okay, that's supination. That's pronation. Supination, pronation. And those, again, happen in the horizontal plane. And then you got radial deviation. And then ulnar deviation. Those happen in the frontal plane. If you're standing in the anatomical position. And again, you do radial deviation and ulnar deviation. Those are the frontal plane. Okay, now we're going to do elbow flexion, elbow extension. Both are in the sagittal plane again. Now we're going to work on shoulder flexion, shoulder extension, shoulder hyperextension. Good. Now shoulder abduction, shoulder adduction, cross. Good. Those are in the frontal plane, in the shoulder flexion again, and extensions in the sagittal plane. Shoulder internal rotation, and shoulder external rotation. Okay, go ahead and do external again, and then internal again. Good. Rotation. Good. The patella is superior to the ankle. The ankle is inferior to the patella. The IT band is lateral to the vastus medialis. The vastus medialis is medial to the IT band. The hip is superior or cephalad to the patella. And the patella is caudad or inferior to the hip. The ASIS is anterior or ventral to the sacrum. The sacrum is posterior or dorsal to the ASIS.